Carmela. I'm a student nurse from Western University. Today I will be performing a thorax and lungs assessment. Can you give me your name? Your date of birth? Okay, so first I would obtain a health history. So do you have any shortness of breath?
No.
Okay, do you have a cough right now?
No.
How many pillows do you sleep at night? Or
One.
do you use to sleep at night?
One.
Okay, are you a smoker?
No.
Okay, then next I would do patient teaching. I would tell the patient that I'm going to ask her to breathe in through your nose and out through your mouth. I'm going to also ask her that she's going to have to remove her gown so I can better listen to the heart sound or the lung sound. And then that my stethoscope might feel cold, so I'll try to warm it up for her before I use it, and also to let me know if she's feeling any dizziness or any discomfort during the process, which might indicate that she's hyperventilating. So I'm going to ask the patient to sit upright and to face the other way. I don't want her breathing on me during this thing. And during that part, you would inspect the patient's work of breathing. You'd also inspect the patient's inhalation versus exhalation phase. So what would be normal would be 1-to-2 ratio, because inhalation, and then it takes longer for the exhalation. 1-to-1 would be, that's too fast, so that's hyperventilating, okay? And then the next step would be to palpate for crepitus, barrel chest, or flail chest, and also for the symmetry of the lungs. To palpate for the crepitus, I would palpate around the clavicle area and make sure that you listen for Rice Krispie sounds. And then the patient is not barrel chested. Next, I would assess for symmetry and flail chest. You can just face backwards. I would place my hand right here. Take a deep breath in. Okay, take a deep breath out. Okay, so that's even and symmetrical. That's how you would assess for it. And then next is auscultation. Some considerations would be, if she was an older patient, I would ask the patient to move her breast out of the way. Make sure that you're not placing your stethoscope on her clothes. Make sure it's directly on the skin, not on any leads or pads or on the ribs. So make sure that you palpate first for the intercostal space instead of placing it on the rib. Okay? And then, again, there's 12 positions on the front, 14 on the back. And then, yeah, and then you start using the ladder pattern. And when you're doing this, make sure you also listen throughout the whole breath, like inhalation and exhalation. Wait for it to finish before moving your stethoscope. Okay? So the first spot would be above the clavicle. Inhale. Exhale. Okay. Inhale. Exhale. And then 1, 2. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Out. In. Out. And then on the side, it's mid-axillary. So 1, out, in, out. And then you would do it on the other side to compare. So 1, and then in, out. Okay. And then you would do the back. And during this time, make sure that you're not placing it on the scapula. So make sure you palpate. So 1, okay, exhale, inhale, exhale. Inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale. Exhale. Inhale. Exhale. Again on the side. And then you have one spot here. Then another one here. And compare it to the other side. 1, inhale. And then exhale. So after doing that, you just did 26 spots, and that's the ladder pattern to compare. You just go that way. And then after the whole assessment, I would describe her breath sounds and then document it. So I would say, patient's lungs are clear to auscultation bilaterally. Patient is not using her accessory muscles. Respirations are unlabored and at regular rate and rhythm. And if the patient said that, yes, she had a cough, then I would also document the consistency, the color, the clarity, and the amount. Okay, Ms. Bill, I'm done with your assessment. Can I get you anything else? Okay, so I would make sure that the call light is within reach, bed in low position, and then that's the end of your assessment. Wash my hands again.